Science of Public Health. In this first mini lecture, we will explore the question of what is public health exactly? You will discover on your learning journey that the scope and practice of public health is in fact very broad, complex, and continuously evolving, and that it is multidisciplinary in nature. What is public health exactly? Well, it may be argued that the primary aim of public health is to empower individuals to make informed decisions and partake in interventions which seek to preserve, promote, and or restore their health and well-being across the lifespan. Public health, what's that all about? Well, public health is all around us. The term public health often conjures up a variety of ideas and images by individuals and society at large. For some, it may entail things like screening for communicable diseases, STIs and TB. For others, it may mean school-based immunization programs. And for others, it may mean safe food supplies and water. Why don't we examine some of these common concepts, actions, and themes that have been jotted down by previous students I have taught over the years? Why don't you start your own list and make a comparison? We often take it for granted here in North America, Europe, Japan, Australia, and many developed nations around the world, in comparison to developing nations, the fact that when we turn on our water taps, we can obtain a safe and clean and drinkable supply of water. However, in many parts of the world, this is certainly not the case. Here we also see a public health warning sign by the Medical Officer of Health for the Durham region of Ontario, Canada, notifying beachgoers and swimmers of the potential risk of contamination with bacteria following a heavy rainfall. In fact, prior to the 19th century, we did not know that the source of many deadly killers actually reside in water. And these include things like cholera, dysentery, typhoid fever, salmonella, E. coli infections, Vibrio, and hepatitis A and E, to name but a few. Indeed, the link between these deadly pathogens and contaminated water supplies has been a major milestone in the history of public health. Proper sanitation and waste management are also critical components of public health. Here we see a portable emergency disposable toilet that is part of the emergency preparedness and disaster management programs in Kyoto, Japan. A region prone to various earthquakes and tsunamis. The safe disposal and management of human and animal waste is critical for maintaining the health and well-being of communities globally. Sewage and effluents are often spilled in high quantities into our water supplies due to a variety of causes, including things like human error, aging sewer and infrastructure systems, excessive downpours of rain associated with extreme weather conditions, and climate change. The scope and levels of prevention have greatly evolved over the past century in public health. And there are currently 5 levels of prevention that are highlighted in the subsequent mini lecture series entitled What is Health Promotion and the 5 Levels of Prevention. Please check it out. So here we see an example of some photos placed on cigarette packaging in Canada, warning individuals about the hazards of smoking and its association to various forms of cancer and other problems. Health Canada has placed warnings on all tobacco products sold in Canada to discourage potential new smokers from taking up this nasty habit, which is a form of primary prevention, and to encourage current smokers with a health condition to quit. That would be secondary prevention. Historically, prevention was influenced by the mechanistic medical model of health, which focused on diseases and its pathological processes. However, our understanding of health has greatly expanded over the past centuries and now are critical to the practice of public health globally. Food safety and public health inspectors. Public health inspectors inspect local grocery stores, restaurants, mobile food vehicles, cafeterias, and catering services to ensure that legislation related to food safety, storage, and preparation are followed. Here you see two examples, one with margarine on the left and the other one with meat actually being stored above the safe load zone, which could put people at risk because bacteria can grow when it is not in that ideal temperature zone. In Canada, the average teen male has been reported to consume over 135 pounds of sugar per year. And the primary sources of these include things like soft drinks, energy drinks, and sports drinks. Here you see a can of pop, and the average can of pop has well over 40 grams of sucrose. Excess sugar consumption, we know, can lead to weight gain and obesity, heart disease, non-alcohol fatty liver disease, type 2 diabetes mellitus, and increase the risks also of developing various forms of cancer, including esophageal, cancers of the small intestine, colon, and breast. So health education and consumer awareness are also critical components and activities of public health. Epidemiology is the scientific study and distribution and determinants of health-related states or events in human populations across the lifespan. And it involves the application of this study to maintain, control, and prevent alterations to health and well-being. The term epidemiology is in fact derived from the Greek words epi, meaning upon or befall, demos, meaning people, and logos, meaning the scientific study of. Epidemiologists seek to determine the etiology or cause of various disorders in diverse populations across the lifespan. For example, how high blood pressure puts you at increased risk for developing things like heart disease, stroke, and kidney disease. The health promotion movement really began during the 21st century and now has the possibility of really reinventing itself due to our understanding of the definition of health, especially from the holistic perspectives. Health is much more than one's biology or genetic makeup. We know it also encompasses things like the mind, spirit, culture, and of course environments in which we live. How can somebody be healthy when they live in a war zone, for example? The ancient practice of Tai Chi is a form of Chinese martial art and philosophy. And a growing body of research has shown that this ancient practice, Tai Chi, actually helps to improve various mental health outcomes. Interestingly, it also increases strength, flexibility, balance, and agility, which are critical to prevent falls, especially for our aging populations. It lowers blood pressure, it reduces inflammation, and improves overall health and well-being. How we design our environments and communities in which we live are also critical. Here you see some bikes in Melbourne, which can be rented by the public to encourage people to live more active and healthy lifestyles. Occupational health and safety falls under the umbrella and mandate of public health and examines both positive and negative health outcomes that are influenced or associated with exposure to general work conditions and or specific hazards like chemicals or radiation or dust, also stress-related work, right? A lot of occupations are very stressful, that may be encountered in a variety of work environments and settings. Mining remains one of the most dangerous occupations around the world. In addition, occupational health and safety also encompasses training of individuals and mandatory use of safety equipment. Here we see some window cleaners. I took this shot in Australia. So they're having safety harnesses for these window cleaners, are critical for the prevention of work-related injuries and mortality. Other examples include things like safety glasses, hard hats, earmuffs to individuals who are exposed to high levels of noise, such as construction workers and individuals who work at airports, for example. These are all critical. Environmental health. The environment is more than one's physical or geographical location, but is also now recognized as a critical social determinant of health and well-being. Environmental health is a branch of public health which examines both positive and negative factors and influences on the environment and ecosystems and how they impact human health. A growing body of research in recent decades has greatly added to our understanding of how various toxins, chemicals, like pesticides and herbicides, negatively impact health from both regional and the global contexts. Global health. Well, the term global health is really an evolving one, which embraces a wide range of health-promoting and health-preserving activities and challenges that span international borders and boundaries. For example, SARS, HIV/AIDS, Ebola, West Nile virus, avian flu, Zika virus are all but a few recent examples of how infectious diseases can easily spread through international boundaries via various travel or trade routes. Quarantine and infection control. Quarantine is one of the oldest public health measures, which dates back to the Black or bubonic plague in Europe, to help limit the spread of diseases from person to person. Here on the left, we see a photo of a quarantine station, the ruins of a quarantine station I took on Quail Island, which is located in Littletown Harbour in South Island of New Zealand. And the island was turned into a quarantine station in 1875 and later into a leper colony from 1907 to 1925. On the right of the screen, we see a public health worker in Hong Kong performing vector control for various mosquito-borne infections, including West Nile virus and yellow fever. Community-based hospice services. Well, hospice is a concept of care that provides compassion, concern, and support for dying clients and their families and loved ones during the last stages of an incurable disease, such as cancer, so they may live with dignity and also as fully and as comfortably as possible in their home and or home-like settings. So palliative care services are also critical components of public health systems. Education and training of various public health professionals and workers is critical. This includes the education and training of new public health professionals and workers, and also ongoing training and education based on the best available evidence to influence best practices and standards, develop new policies, and also legislations. Research and evidence-informed practice. While research is critical to the practice and discipline of public health. Now, research can be conducted in a variety of settings besides your traditional laboratory-based settings. In fact, it can be conducted in community settings, such as this mobile research van, which I snapped in Japan. It can be conducted in workplaces, in community-based clinics, and in schools, to name but a few locations. The word evidence in here includes, but is not necessarily limited to, published research reports only. So evidence can also include things like best practice guidelines, new legislation, laws and policies, direct clinical observation, experiences from both lay and expert opinions by various community stakeholders. Leadership, a very powerful word. Leadership in the public health context involves things such as research, developing and influencing new policies, legislation, practice standards. And it is not just the ability to lead or guide individuals, families, or communities towards higher levels or states of health and wellness. The field of public health is inherently multidisciplinary, made up of a wide range of healthcare professionals and workers that include public health nurses, physicians, public health inspectors, health promoters, nutritionists, dentists, and epidemiologists, to name but a few. So public health leaders engage in various behaviors and activities, and these include things like mentoring, providing guidance and support, coaching, and recognition of new challenges as well, to name but a few activities undertaken. Access to healthcare services and medications. Here we see a photo of a pharmacy I took in Cuba. You can see that the shelves are relatively bare in comparison to pharmacies in North America, in Europe, Japan, Australia, New Zealand, and other developed nations of the world. Access to healthcare services and medications should not be based on one's social economic status or ability to pay for these services. Health should be a universal human right. This is one of the ongoing challenges facing public health in the new millennium. The social determinants of health. So here on the left we see a Rolls Royce, and we contrast it with a squatter's house that I filmed here in Malacca. We shall examine the 15 social determinants of health in a separate upcoming mini public health lecture series. Suffice it to say that social determinants of health are defined as very basic structural determinants and conditions of daily living responsible for health. They include such things as the distribution of power, income, goods and services, education, proper housing, nutrition, and the environment. Okay? Poverty. Poverty is one of the major social determinants of health. We know that individuals with higher social economic status, or SES, have so much better health outcomes in comparison to those with lower social economic status. These include a better overall morbidity, mortality measures, and poverty, extreme poverty defined as individuals who live on $1.75 per day. They have the worst, Canadian, have the worst outcomes for all groups, right? Imagine living on $1.75 per day. That includes all your food, your housing, your clothes, the water, anything that you have, the medications you have to consume. That's about equivalent to a cup of coffee here in Canada, right? And you have to survive on that. Just imagine living on $1.75 a day. Very difficult, and very difficult to maintain one's health and well-being with that little amount of money. In Canada, for example, we have various Indigenous people, including First Nations, Métis, and Inuit populations. We know that Indigenous people unfortunately have a decreased life expectancy in comparison to non-Indigenous Canadians by approximately 10 years or so. Moreover, they also have increased incidence of heart disease, diabetes, fatal drownings, kidney disease, blindness, amputation of limbs, and the Inuit population especially have some of the highest rates of suicide globally. The concept of cultural safety is very important. We have to realize as public healthcare professionals and workers that Indigenous definitions of health often conflict with Western definitions. For example, here we see on the right-hand side a photo I took of sweetgrass being burnt as part of a cleansing and healing ceremony, First Nation ceremony here in Canada. The term cultural safety was first coined during the 1980s in New Zealand in response to the poor treatment received by the Maori people who are Indigenous New Zealanders over there. Global warming, climate change, and environmental health. Global warming involves an increase in the Earth's overall temperature as a result of both human and natural causes, including things like greenhouse emissions through the burning of fossil fuels. We see industrial pollution, depletion of the ozone layer, deforestation, and volcanic emissions. Climate change is defined as a significant and dramatic change in frequency, intensity, spatial extent, duration, and timing of extreme weather, things like tornado and hurricanes and heat waves, and climate-associated events like drought, ice storms, and flooding. Collectively, these events can negatively impact human health and well-being, and in fact may lead to more morbidity and mortality. Outbreaks, epidemics, and pandemics. When we hear these words, they're often associated with the practice and discipline of public health. Things like Zika virus, H1N1, West Nile, Lyme disease, Ebola, cholera, measles, yellow fever, scarlet fever, and the list goes on and on. Both the national and global surveillance and tracking of various communicable or infectious diseases are major components of public health. Screening for diseases and early detection. Screening, as we shall learn in a subsequent mini lecture series related to public health, is a form of secondary prevention. High blood pressure has been dubbed the silent killer because there are no overt signs and symptoms experienced by individuals for this condition. High blood pressure can significantly increase the risk for various diseases, including heart disease, stroke, and kidney disease, to name but a few conditions. Mental health and wellness. Well, health is so much more than one's biology or genetic makeup, and public health care professionals and workers are also concerned with the mental health and well-being of their clients across the lifespan. In fact, simply stated, there can be no health without mental health. Promoting mental health provides the capacity of individuals to realize their abilities, develop effective coping skills to manage a variety of daily and unexpected stressors, take control of one's life, and make positive contributions to society at large. Vector control for mosquito-borne diseases. Well, let me ask you a question. What do you think is the most deadly animal on the face of planet Earth? Is it a saber-toothed tiger? Is it some elephant? Is it some poisonous snake, or perhaps the great white shark? No. It may surprise you to learn that it is the mosquito. It might seem hard to believe that something so small could be so lethal and responsible for several million deaths and hundreds of millions of cases every single year globally. By undermining one's health and work capacity, literally of hundreds of millions of people globally, the mosquito is also closely linked to poverty and negatively to various social and economic development around the world. Many public health activities, such as vector control, often do not go noticed by the public at large. Here on the right-hand side, you see a sewer basin, a photo I snapped in my neighborhood in Durham region of Ontario. And on the upper left corner there, you see some green fluorescent paint. Well, many people walk by this sewer basin and don't even give it a second glance. What that means, that little green spray painted dot there, is that this sewer basin has been in fact treated for the West Nile virus. So the larvae, mosquito larvae, cannot grow. So a lot of these activities are in fact invisible to the public at large. Disaster and emergency preparedness are critical components of all public health systems regionally and nationally. Public health officials, professionals, and workers have to devise, develop, train, and prepare for a variety of natural disasters, including things like earthquakes, tsunamis, floods, forest fires, and bioterrorist threats as well, to name but a few. So, after reviewing some of these slides, based on these examples that we have highlighted, you can see that the practice and scope of public health is in fact very broad, very complex, continuously evolving, and multidisciplinary in nature. So let's define this important and critical concept. So public health is a holistic and evidence-informed discipline that seeks to promote, maintain, and or restore the health and quality of life of individuals, families, communities, or entire populations over the lifespan through health promotion and prevention and various primary healthcare initiatives, activities, policies, and or legislations. Art and science of persuasion for advancing and promoting the health of society at large. So let's examine that critical word, persuasion, and what I mean by it. Persuasion, we know, is an act or fact of convincing someone or of being persuaded to engage in some sort of new activity or to do something. This is critical for public health because we want to persuade individuals, based on the best available evidence, to be more physically active, for example, why they should stop smoking, to make healthy food choices, or to convince politicians to make new policies and legislations to protect the health and safety of individuals at large. So we've learned about public health, but what is private health care if we contrast it? Well, private as opposed to public often refers to out-of-pocket healthcare services that are paid for by an individual or by another means, such as a private insurance plans or benefits. You may have employee health benefits, such as dental plan, vision screening, etc., that might be paid by your employer. That's private health care. Another closely associated word is community health. And community health is a discipline within public health, which concerns itself with the study and improvement of the health characteristics of communities that tend to focus on geographical areas or boundaries, rather than on populations with shared characteristics. So community health, think of community health as your neighborhood, all right? What is happening in your specific neighborhood that you live in? Who are public health professionals and workers? Well, public health professionals include individuals such as physicians and nurses, public health inspectors, health promoters, epidemiologists, nutritionists, and dentists. Public health workers are typically regional or community-based health advocates who seek to promote health and well-being in the broadest form. Okay, what are some major practice settings for public health professionals and workers? Well, here's a couple of examples. They may include, but are not necessarily limited to, rural and remote settings. It could be a nursing outpost in the Northwest Territories here in Canada. It could be urban settings or various urban settings such as street nursing in Toronto and other large cities, community health centers, schools targeting children, governmental and non-governmental agencies, a variety of occupational and work settings, private homes, and of course community-based clinics, to name but a few. What are some of the roles of public health professionals and workers? They include, but are not necessarily limited to, being an advocate, being a clinician, being a collaborator with stakeholders in the community, a consultant on various health-related health matters, a case manager, an educator, a health promoter, someone who develops policies or helps develop legislation, and of course, a researcher as well. These are all some of the activities that public health professionals and workers undertake in their daily practice. Here is a suggested additional reading you may be interested in. This chapter will highlight many of the terms, concepts, and behaviors by public health care professionals and workers that we highlighted in this first of our mini lecture series related to public health. Well, that's all, folks. Thank you for listening, and I hope that you listen to other lectures in this mini lecture series related